So, good evening, everyone. So, in the previous topic, we have discussed about the types of arrhythmias and the definition of arrhythmia. So, the next topic would be what are all the factors which will lead to arrhythmias. So, if we take about tachycardia, the first factor would be either increase in body temperature, what you call it as pyrexia, or what you call it as fever. In terms of medical terms, we define increase in body temperature as pyrexia or fever. So this is the first factor which may also leads to tachycardia. So the second one, what you call it as bradycardia. So what are all the factors which may leads to bradycardia, which may leads to slow heartbeat? So the main factor which comes under is the hypotension, or either we call it as low blood pressure. Low blood pressure. So these are the factors which may lead to either tachycardia or bradycardia. I have discussed only one because these are the only two major factors which may lead to tachycardia or bradycardia. I will be discussing the next again the classification of tachycardia's factors later. So the next topic will be the main aspect in cardiovascular topic is about blockages. So what do you mean by blockages? I think you might be knowing, like if a patient has got cardiac blockage, then you might be knowing they either perform like inserting a stent, what you call it as angioplasty, or if there are multiple blockages present in heart, so they do perform open heart surgery, what you call it as CABG, coronary artery bypass graft. So let me write it down over here. So the blockages are of two types. One is coronary artery blockage. Coronary artery blockage. And the second one is the junctional blockage or AV node blockage. And the third one is SA node blockage, what you call it as pacemaker of the heart. We define SA node as pacemaker of the heart because this is a kind of excitable tissue present in the heart which is responsible for conducting impulses in the heart and generating the heartbeat and even maintenance of the rhythm. So we also call SA node as pacemaker of the heart. So coronary artery blockage. So there are, like if we talk about the prophylaxis or the treatment of coronary artery blockage, we usually we have got two types. If we talk about the prophylaxis, like treatment. it has got two types. If there is any single blockage found in the coronary artery, we perform a minimally invasive surgery called angioplasty, where it has got two axes. One is either radial axis or femoral axis. Means, like, whenever we are inserting a stent to an artery, so how do you find an axis, or how do you perform the angioplasty through which a vessel or the artery or the accessible artery, where we can reach up to the coronary artery and we can clear the blockage by inserting a stent and by inflating a balloon towards it, so the blockage can be cleared and there will be re-establishment of normal circulation. So the kind of blood circulation we find during blockage is turbulent. Means, usually we have got two types of blood flow. One is streamline flow and another is turbulent flow. Streamline flow is found where the circulation is normal and there is no a plaque or any something disturbance to the coronary artery wall present. Either it may be due to atherosclerosis or arteriosclerosis. So if we find any of these diseases, then the bloodstream gets shifted to another type of flow, what we call it as turbulent flow. So coming up to the two axes, as I mentioned earlier, one is radial axis. So what is radial axis in angioplasty? So radial axis is the insertion of stent is performed by taking the radial artery as a route to the coronary artery. So if you want to access the blockage of coronary artery, so we have to take one accessible artery where we can reach up to the coronary artery. So either we can take the radial artery as the access for insertion of stent, where it clears the blockages by inserting a stent, and a balloon which is present in the stent. The balloon gets inflated and the plaques gets ascided, and there will be a re-establishment of normal circulation. So the radial artery is used for performing the angioplasty. So now talking about another one called as femoral axis. So what do you mean by femoral axis? As I have said earlier, radial axis is we take the one of the accessible artery, which is a one-way route for reaching coronary artery. So there is another artery called femoral artery, which is present in our thigh. I think you might have learnt about this in anatomy. Present in thigh, in the anterior aspect of thigh. So we take the femoral artery as an axis for a one-way route to reach up to the coronary artery. As we have mentioned earlier, like radial artery is also used as an accessing route for reaching up to the coronary artery to insert the stent and to clear the blockage. As the same way, I'm sorry for the disturbance. As the same way, like femoral artery is also used in help in like accessing the route for coronary artery in order to clear the blockage. So this is the type. This is a type of treatment where we perform if there is any single blockage found in coronary artery. So angioplasty is only performed if there is any like finding of single blockage in the coronary artery. So how do we treat a patient if he or she has got multiple blockages in the heart? So talking about multiple blockages in coronary artery, blockages in the heart. So if a patient has got multiple blockages in the heart, so the treatment or prophylaxis is through surgical intervention. I'm sorry for the spelling mistake. Surgical intervention. So what we call it as open heart surgery, or even we call it as CABG, or even we may also pronounce it as CABG. So the full form of CABG is coronary artery bypass graft. So what we take what do you mean by coronary artery bypass graft? So consider if there are multiple blockages found in coronary artery, and if you want to clear the like the blockage is present in the artery in the heart, so we cannot like perform angioplasty multiple times, because there is no access for inserting more than 2 stents. So what we do is we take a graft. A graft is taken either from our leg, what we call the great saphenous vein, or from our chest, what we call it as internal thoracic artery, which is a branch of axillary artery. I think you might have learned about this in anatomy. Branch of axillary artery. So in order to clear the blockage, what we do is we cut off the blocked artery where the blockage is present, and we take another like a kind of graft which helps in establishment of a joining of another vessel and re-establishment of the blood circulation from that blocked artery to the grafted part. So this helps in re-establishment of circulation also, and the clearance of blockage. So a graft is taken, as I said, So we were talking earlier about the graft. So either the graft is taken from your leg, so what we call it as the great saphenous vein, which is present in anterior part of our leg. It is like but are studied in anatomy. So the great saphenous vein is taken from the leg, or like if there is no accessible of great saphenous vein, or if there is an accessible of great saphenous vein, or if a patient has got like the access of internal thoracic artery is very rare. It is around 10 to 15% present in individuals. It's a rare case. So this is the what we call it as a process called as coronary artery bypass graft. So again we classify this CABG process into two types. One is minimally invasive, CABG, or what you call as coronary artery bypass graft, and another one is off pump. So what do you mean by minimally invasive CABG and off pump CABG? So minimally invasive CABG is a type of coronary process where a machine is inserted to the heart during for circulation of blood to the heart, because in order to perform the surgery, we sometimes the heart of the patient has circulation of systemic circulation must be arrested if there is any severe case. So we invert a machine into the heart in order to make sure that there is a circulation found in heart and into the systemic circulation. So this type of CABG we call it as minimally invasive coronary artery bypass graft, and the another one is off pump CABG. So this is the simple way. If we take about off pump CABG, then there is no insertion of machine, or the machine which is used in which helps in circulation of blood to the heart and to the systemic circulation. So this is not, the machine is not used in this type of method, because the severity will be more lesser than what we do in minimally invasive. It depends on the severity of the patient whether he has to undergo the minimally invasive CABG or the off pump CABG. So let me write it down here in a simple manner. Machine is used, which is used for circulation, and machine is not used. So this is the simple way which we can classify these two types of CABG, or the two process which is used in open heart surgery. So I hope you might have liked this video. So I thank you all for your attention.